Welcome everyone to our MusiCares 101. My name is Angela and I'm a client manager here at MusiCares. So we are here today for a deep dive into all of the programs and services that MusiCares offers to the music community. So after the presentation, we will hold a Q&A. So please add any questions that you have directly into the Q&A box, and we will do our best to address your questions at the end of today's webinar. Lastly, a recap of the information that we covered today will be emailed to you after the conclusion of today's webinar. All right, next slide, please. So who is MusiCares? Well, we are a national 501c3 nonprofit serving as a safety net for music industry professionals. Since 1989, we've provided over 300,000 services and distributed more than $100 million in assistance to the music community. We help the humans behind the music because music gives so much to the world. Next slide. So who is eligible for MusiCare services? So we serve all professionals in the music industry, not just musicians and singer-songwriters. So this includes producers, stagehands, engineers, agents, tour bus drivers, security, crew, tour managers, music journalists, background vocalists, and more. So to demonstrate eligibility, you must be able to show at least 5 years of paid industry experience or at least 6 commercial credits. And so I'm going to give you a few notes on both of those. So the 5 years of paid industry experience does not have to be full-time, recent, or consecutive. We also do not require a minimum income made in the industry. So in other words, even if your music work is not the primary source of your income, you can still be eligible as long as you can show at least 5 years of paid work. So how do you show this? We accept a wide variety of documentation, and we can work with you to brainstorm alternate documentation to demonstrate paid experience. Some examples of the type of documentation that we accept include W-2s, 1099s, copies of signed contracts, pay stubs, checks, Cash App transactions indicating paid worker gigs, and more. A few notes on the 6 commercial credits. So we will ask for a copy of a royalty or distribution statement that includes your full name and clearly lists at least 6 credits. So we cannot accept screenshots of like online discographies or maybe your account on a streaming platform. We would ask for the actual statements showing you have credits. And a last note on credits, you do not necessarily have to be making much off of those credits. It's clear that if it's clear that the credits are commercial, that is sufficient. So now that we've reviewed eligibility requirements, I'm going to hand it off to Jen to discuss the different ways that MusiCares can help.
Hi, everybody. Thank you for joining. My name is Jennifer Leff, and I am the Managing Director of Human Services. I'm based in New York. So I'm going to share general information about how MusiCares can help you, and then I'll provide details about human services. So first off, as the slide says, how can MusiCares help you? When a music professional contacts us, we consider each request on an individual basis. And we identify how can we best support you due to the unforeseen changes or a time of struggle. So through our customized care approach, we consider the scope of the individual needs. We can provide financial assistance and resources to help navigate unanticipated challenges. We offer preventive clinics that address overall health and wellness. And thirdly, we offer support groups and workshops that cover a variety of areas. And these educational opportunities are intended to empower and arm you with information. So ultimately, to help you sustain your place in the music community and industry. Next slide, please. Here are some examples of how our grants can help. We can provide payment for rent or a mortgage due to a job loss. We can provide referrals and financial assistance for therapy and or substance use treatment. We can help with funeral costs. If you're overwhelmed due to an unexpected situation, when you speak with our staff, we are going to help you identify priority needs and how we can be most supportive, be it through MusiCares assistance or referrals to other organizations. Next slide. So on to human services. Our team works with individuals who are experiencing a recent hardship due to, but certainly not limited to, a sudden job loss, a last-minute canceled tour, perhaps a fire, an acute situation with a family member. We've even helped people who've had car accidents. And during these times, we will step in and provide financial relief for essential living needs. And essential living needs include rent, mortgage, car payments, utilities, insurance premiums, funeral or burial costs, and childcare, which we know is a large expense. These are all need-based grants. So very briefly, after you reach out and complete a grant request form, you'll speak with a client manager and a determination will be made regarding a grant. Please know all grants are paid to third parties. So that means the landlord, Con Ed, a doctor. Provided we have all information needed, we can typically send funds to the payee within about 15 business days. But just remember, this is a process, so it does not happen overnight. Lastly, before I pass this on to my colleague Stephanie, and you might hear this many times throughout the 101, we know it can be humbling to reach out for assistance. And please know that everything that you share with MusiCares is kept confidential. Now you'll hear from Steph.
Hi, everyone. I am Stephanie Curtis. I'm based in Nashville, Tennessee. Shout out to any Nashville folks. I've been with MusiCares now a little over 10 years, and I am currently the Managing Director of Health Services. And I just want to say thank you all for taking the time to come meet with us today, because all of us here want to ensure that everyone in the industry knows fully all the services that are available to you through MusiCares. So as this slide indicates, the health team at MusiCares can help with medical bills and dental bills for music industry professionals who meet MusiCares eligibility requirements. These could be bills that individuals have accrued previously and haven't been able to pay, or it could be a treatment plan that they're currently facing. Additionally, MusiCares health team is able to support with preventative screenings such as mammograms or cancer screenings that may not be covered by insurance. And then we also offer our preventative care clinics through our MusiCares partnerships with providers across the country. And we'll go into that a little bit more in detail later. But it's important to note additionally that we are able to use any awarded grant funds to help with essential monthly bills such as rent or utilities, while an industry professional might be navigating an illness or caring for a loved one as well. So although the primary focus of the need might be because of a medical or health need, we can certainly help with those essential monthly bill needs as well. Here at MusiCares, we know that life can get messy and complicated, and that's why we want to be a safe place for folks to reach out. As Jen mentioned earlier, regardless of the circumstances, MusiCares is here to support, and we prioritize confidentiality. We know how difficult it is to reach out for help, and so we absolutely ensure that all of our staff understands confidentiality and that we do everything we need to do to ensure HIPAA compliance when it comes to medical documentation. And so we want to be with individuals throughout their health or medical need journey. And so an example of that might look like a crew member on tour injures their back and they're in such severe pain that they are unable to work. So they have to come off the road, which means they're facing loss of income because they were counting on that to finish the tour. So now they're losing that income, but they're also home and they are having to have tests and screenings and see healthcare providers. It could end up being a surgery need with accruing some medical debt, along with some longer term physical therapy needs for rehab. And so in an instance like this, MusiCares would be able to meet with that individual early on, make sure that they know that we're here, potentially help get some grant funds approved to help with not only those medical bills that they might be facing for the surgery, but also give some additional funding to help with that ongoing rehabilitation need. Additionally, as I said earlier, we could help with some short-term basic living bills, rent, utilities, because obviously when someone's physically unable to work and they're recovering, we want them to be able to focus fully on their recovery. And I think it's important, I want to say, additionally, it is completely understandable that in a circumstance like this, someone's mental health is going to be impacted. There are dramatic life changes going on, coming off the road and being home, missing out on that opportunity and not being able to do what you feel like you're meant to do. There is the physical pain that individuals are in, the financial stressors, and the social isolation that comes along with not being able to get out and about. And so all of those things can impact our mental health. And so I just want to make sure that I clarify that in instances like this, even though it may not be a primary mental health need, MusiCares can definitely, the health team can also help facilitate a mental health grant to help with outpatient therapy costs while someone's navigating their health journey. And so a variable to keep in mind is that MusiCares is only form of payment is a business check. We are unable to make any other type of payment, and we aren't able to, unfortunately, therefore log into medical portals or dental portals. We understand that that's kind of where the healthcare field is going, but currently MusiCares is unable to make a payment in that way, as we need to be able to have it in the form of a business check that we mail directly to the individuals, to the healthcare providers. But please just know that we understand that can be a challenge, and that each type of provider, and whether it's an outpatient procedure that wants payment up front or an anesthesia bill that you receive, you'll get billed later. Our client managers and our health team staff can work with you to make sure that we are able to help with those costs. It just might take a little longer or look a little different since we are limited in that way. And then another question that we often get is, what is the average grant dollar amount? How much can I expect if I'm reaching out for a medical need or a dental need? And, candidly, we don't really have average amounts. We genuinely want to meet people where they are and try to meet as much of a need as we possibly can. And so that means all of the variables for each individual is taken into account. Some individuals are facing a dental bill that's $500, whereas others might be facing medical bills in excess of $200,000. And so those types of variables, along with the specific financial circumstances that individual is going through, all of those things are taken into account. But rest assured that we absolutely try to ensure that we are offering as much financial support as possible during these difficult times. And even when we aren't able to address the need in full, we are able to refer to other organizations that can step in and pick up where MusiCares left off. And that could be a variety of partners that you might be familiar with, such as Sweet Relief, Music Health Alliance, or the Entertainment Community Fund. And so with that, I'm going to kick it to my colleague, Marche.
Hi, everyone. I'm Marche. I'm based in LA, and I'm the managing director of the Mental Health and Addiction Recovery team. I just want to now take some time to dive into the financial assistance that the Mental Health and Addiction Recovery team offers. We offer both assistance for both mental health and addiction recovery services. This includes financial assistance for psychotherapy, including individual, couples, intensive, and residential therapy services, just to name a few. And we also provide grants for financial assistance for addiction recovery services that may include 28-day stay at inpatient residential, partial hospitalization programs, intensive outpatient programs, detox, sober living, and aftercare services, to name a few. Our team has an extensive list of psychotherapists and treatment centers that we work with to ensure that we are providing the music community with ample resources and referrals. When seeking assistance for either a mental health or addiction recovery needs grant, we will provide you with a mental health assessment in addition to our grant request form. Once these two forms are completed and submitted, a client manager will review your case and get in contact with you to discuss the next steps. If you are already working with a therapist, we will make a payment directly to the therapist after the session occurs. Otherwise, we will provide you with referrals for therapists in your area. Similar to the psychotherapy referral process, if you have already been in contact with a treatment center and would like to attend their inpatient program, we will reach out to the treatment center directly to discuss our rates and policies and provide them with payment as well. Otherwise, if you do not have a treatment center that you would like to attend, we will also offer you a variety of options based off of the needs from your assessment. We'll have you look through them, and once you've selected one that is the best fit for you, we'll reach out to that treatment center and coordinate your stay and arrival. Please note that MusiCares is unable to financially assist with the expense of travel to and from treatment centers. Travel is a client's responsibility. The treatment center will bill MusiCares directly once you arrive. And please note that when you apply for a mental health or addiction recovery grant, all the information that you provide to us is confidential. In addition to the financial assistance that we provide for the mental health and addiction recovery grants, we also have services that include weekly virtual support groups, safe harbor rooms, wellness rooms, and more. I'm going to pass it over to my colleague, Nana.
Hi, everyone. Thank you so much for joining us. My name is Nana, and I'm a part of the human team here at MusiCares. MusiCares is able to assist through giving funds during times of disaster. These funds can assist those with lodging, food, and basic living needs. So you can see here the list of some of the disasters we have been able to provide relief for. Most recently, we have been able to provide relief funds towards the music community impacted by Hurricane Helene and Milton. And please note that you do still need to meet our eligibility requirements. Next slide, please. So MusiCares has a variety of different programs, which are listed here, and we will get into what each of these are. Next slide. We are able to offer one-on-one financial coaching where you can discuss a financial plan with one of our providers. We can offer up to 5 sessions. Of course, the number of sessions that is best can be determined by you and the provider that you speak to. This is a remote program offering, so it does not matter where you live and you can easily partake. Next slide. We are also able to offer a free 1-year subscription to YNAB, which stands for You Need a Budget. An app can be a great tool to help you manage and budget your money, keep track of your spending and your financial goals. And YNAB has a ton of resources as well on how to assist you in navigating the app. If you're interested in these programs, you can go to our website that's listed here. It's musicares.org/events, where you can go ahead and apply online. Now I will pass it on to Chloe on the health team.
Hi, everyone. Thanks, Nana. I'm Chloe. I'm the coordinator on the health team over here at MusiCares. I'm going to start by talking about what many of you may know are biannual clinics or our preventative care clinics. So MusiCares partners with health providers across the country to offer free preventative healthcare appointments twice a year, every year. These clinics are completely free to MusiCares clients, as MusiCares covers the cost with the providers for our clients to have access to these resources. So in the months of March and September, MusiCares partners with vision practices to offer vision clinics, during which an individual receives a comprehensive vision exam and prescription if needed. In the months of April and October, MusiCares partners with physical therapist offices, movement specialists, and chiropractors to offer free appointments to address physical conditions and treat or prevent repetitive stress injuries. And finally, in the months of May and November, MusiCares partners with dental practices across the country to offer clinics during which participants receive a comprehensive dental exam for bite ring, x-rays, and a cleaning. So if you attend any one of our clinics and the provider recommends follow-up care, you can request a grant to help pay for that care through our financial assistance program that we reviewed earlier. Many of you are well aware that many of these clinics fill up very quickly. The registration links for these clinics are sent out about a month in advance via email to our clients. So if you do not receive emails from MusiCares about these clinics but would like to, please email musicaresrelief@musicares.org and ask to be added to our email marketing chain. And this email address will be shared again on the screen at the end of the presentation. So MusiCares also partners with Tuned to offer the music community access to highly specialized music audiologists. These audiologists bring years of experience focusing on the unique needs of music industry professionals in hearing loss prevention, amplification, tinnitus, and disorder management, in-ear monitors, and much, much more. Each person will receive one virtual telehealth consultation with a music audiologist, and this virtual consult includes a full hearing screening, education, and personalized recommendations, as well as a pair of filtered earplugs. So for individuals who require further care for tinnitus, hearing disorder management, or anything else, tuned audiologists may recommend follow-up sessions. MusiCare's most recent addition to our ongoing clinics is in partnership with On Point Nutrition, a leader in virtual nutrition services. Their award-winning team of registered dietitians is dedicated to empowering you with the knowledge and anti-diet skills to build a sustainable and healthy lifestyle and habits tailored to your unique lifestyle. So whether you're at home or on tour, we offer one complimentary virtual coaching session with one of OnPoint's nutrition dietitians. During this one-time session, you'll receive personalized feedback on your current nutrition practices, answers to your questions about nutrition and chronic illnesses, and guidance to create achievable goals for a healthier and happier lifestyle. If follow-up sessions are recommended and you need financial assistance to access these, you may apply for an individual grant with MusiCares. So smoking cessation, MusiCares has partnered with Optum Quit for Life to help music industry professionals quit smoking and or vaping. Participants will receive 5 one-on-one coaching sessions with a certified tobacco cessation specialist, nicotine replacement therapy, and online support groups and resources. With that, I'm going to pass it on to Haitlin from our mental health team.
Thank you, Chloe. Hi, everyone. I'm Halen. I'm the coordinator on the Mental Health and Addiction Recovery Services team. And today we're going to dive into our support group. So we understand that our financial assistance is limited and that mental health and addiction recovery care continue beyond what our grants can offer. Therefore, we offer emotional support and addiction recovery support groups on a weekly basis. These support groups are free of charge and facilitated by licensed professionals. There are 4 weekly emotional support groups and 6 addiction recovery groups. These emotional support groups include a women's group, a Black music community group, an LGBTQIA+ community group, and a music professionals support group. Additionally, we run a Navigating the Holiday Blues support group for 6 weeks during the holiday season. When short-term support groups are held, information will be sent out via email and posted on our socials. Each support group is held once a week, and many of the support group times differ to provide more flexibility for individual schedules. All of our support groups are listed on our website under the Get Help tab, where you'll find a tab labeled Support Groups. To join a support group, we ask that you please reach out directly to the group facilitator. Their contact information is listed under the group title and time. Next slide, please. So safe harbor rooms. So MusiCares offers safe harbor rooms at various music events and festivals around the nation. Safe harbor rooms are designed to create a safe, supportive, and welcoming space for music professionals that are in recovery from drugs and alcohol or desire to do so. These safe harbor rooms are not a 12-step meeting, and they welcome all people in a recovery program. When MusiCares Safe Harbor Room is present at a music festival, it is typically held back of house and runs for about an hour. Flyers are posted when we are present at a festival, but you're always more than welcome to reach out and ask if we'll be boots on the ground at any music events. Next slide. So last year, MusiCares put together several wellness activations for music industry professionals, and these wellness activations received wonderful feedback, and so we continued providing one-stop health and wellness clinics around the nation. At these events, you may find providers such as psychotherapists, massage therapists, holistic chiropractors, yoga and breathwork providers, and vision, dental, and hearing providers. Psychotherapists are present for one-on-one sessions and will equip you with tools and resources to navigate mental health challenges. Massage therapists, holistic chiropractors, and yoga providers are present to provide their services in shortened increments such as 10-minute massages, limited alignments, and 15-minute yoga and breathwork sessions. Our health services vary at each event, but many times we have providers present to create custom molded filtered earplugs to reduce the risk of hearing damage. These events aim to provide a multitude of resources to individuals in the music community to promote a holistic approach to caring for one's well-being. Please be on the lookout for emails from MusiCares and check out our socials for these events in your area as space is limited and spots do fill up quickly. Throwing it back to you, Angela.
So we sometimes have individuals ask us how they can thank us for the support that we've provided them. We typically say that the best thing you can do is to help us spread the word about MusiCares and our services. So whether you find yourself in need or have a colleague or friend in the industry that could use our help, we encourage you to please help us spread the word about our financial assistance, our preventive care clinics, and our educational offerings. So in fact, we actually find that most individuals who come to MusiCares were referred to us by a friend or colleague in the industry. Next slide. So thank you so much for joining us to learn about the variety of programs and services that MusiCares offers to the music industry. As a reminder, we will email you a recap of all of the information we shared in case you missed anything. And to contact us for assistance, access one of our additional services, or if you have any questions, there are a few ways to contact us. You can visit our website at musiccares.org. Email us at musiccaresrelief@musiccares.org or call us at 800-687-4227. Next slide. So now we enter the Q&A portion of this webinar. So we've received some great questions from you all, and we will do our best to address as many as we can during the time we have remaining. If your specific question is not addressed, please do reach out to us after the webinar. I am going to kick it over to Stephanie to start us off with some frequently asked questions.
Thanks, Angela. All right, let's start addressing these one at a time. So, can I receive financial assistance more than once? Absolutely. MusiCares is here to support individuals whenever an unexpected emergency occurs. So, if there's ever anything that comes your way, I know we would all prefer to be the one to be able to offer help than need help, but that's really what MusiCares is here for. So, never hesitate to reach out regardless of previous assistance. If for some reason we aren't able to assist at that time, we still want you to reach out because, again, we can make sure that we're connecting you with alternate resources. I have insurance. Can MusiCares still help me? Absolutely. Insurance status does not impact MusiCares' ability to assist. In fact, if anything, we're so grateful when people have insurance because that means hopefully our grant funds and our grant dollars can hopefully meet the need in full. Do I need to repay this support? No. MusiCares grants are just that, they're grants. And so they are not a loan or anything that needs to be repaid. In fact, they aren't even anything that would need to be reported on your income because the fact that it is paid to a third party directly means that it's not considered income and doesn't need to be reported on your taxes. So it does not need to be repaid. It is a grant that you deserve. And I kind of jumped over to my other one. Do I need to report this on my taxes? No. Again, because of the fact that we pay the third party and rather than giving it to you directly, it's not something that needs to be reported on taxes. Is there an income limit for MusiCares support? No. We absolutely understand that the music industry, more than many other industries, has a very variable income, and that if someone has a large lump sum in their account, that might be the one lump sum they're going to get for the remainder of the year. So we do not have any income limits set. Although the income and the financial circumstances of an individual might impact the amount of assistance we can provide, there is no regulation or income limit to be eligible for MusiCares support. And the last kind of FAQ we get is, can I request support for my spouse or children? And absolutely, if someone lives in your house, if it is your spouse or your child that is sick or in need, it is impacting you and your financial circumstances. So absolutely, you can reach out to MusiCares. Let us know what support you're needing. And again, many times each situation is so different and unique. If the specific cost that your child or spouse needs falls outside the scope, we can still get creative and find ways that we're able to assist, perhaps paying other bills or something to offset those costs. And so I'll kick it back to Angela for some additional questions.
Thank you so much, Stephanie. And I'm going to ask Marche and Jennifer to join us. Fantastic. So, Mark, I saw that you put a question in the chat and you read my mind. That is the first question we're actually going to ask. So, one of the questions we get is, do you have to be a member of the Recording Academy to access MusiCares services? So I'm going to kick that to Jen.
Absolutely not. And I love answering this question. And that's one of the things I love about MusiCares. You do not need to be a member of the Academy. You have to have at least 5 paid years in the industry and 6 commercially released tracks. Now that is to receive direct financial assistance. If you want to attend one of our workshops, you do not need to meet those requirements. And the reason for that is we want to provide you with the information that will help you once you get into the industry. So spread the word. You do not need to be a member of the Recording Academy.
Great. And Jen, we're going to stick with you for a moment. So another question is around this language of like a qualifying event. So like if someone comes to us and they start filling out our grant request form online, it's going to ask them for documentation showing that something kind of recently happened to affect their finances. Can you talk a little bit about what we mean when we say qualifying event? And can you maybe give an example of a case that has a qualifying event and then maybe one that does not?
So MusiCares grants are need-based. And to be considered for a grant, we require documentation about a change in recent circumstances. So for example, Angela is a stagehand and she was banking on the tour that's coming up next week to pay her rent for December. She finds out today that the tour is canceled. That is an unexpected circumstance that's affecting her financial situation. Beth is a producer and somebody canceled a contract at the last minute because they were ill. There's going to be documentation of that, and Seth will be able to receive assistance. Something that is not is, I haven't been able to find work since the pandemic. I need help paying my rent. When it comes to longer term needs, that isn't something we can assist with. We're here to assist with short-term acute needs.
Okay.
Hope that's helpful.
Thank you so much, Jennifer. We're going to shift a little bit over to health insurance. So we sometimes get this question. So I'm going to pose this to you, Stephanie. Does MusiCares provide health insurance? If not, does MusiCares provide any help to sign up for health insurance?
Yeah, and I'm so glad this question came up because it is, you could have put that on the FAQ sheet as well. It's definitely one that we get often. So it's a little bit of a complicated answer, so bear with me. But does MusiCares offer health insurance in the way that individuals think about it, where we pay for ongoing medical needs? No, MusiCares is not able to help with those ongoing doctor's visits, with like your copay and things like that. We don't. Our preventative clinics in many ways are to fill gaps of the industry. We know that most music industry professionals, even when they have health insurance, typically don't have access to some of those additional supplemental services. And so that's why we are trying to provide those dental, vision, and movement specialist opportunities. And so those are intended to support with that, but we do not offer health insurance. However, if individuals need help signing up, we absolutely have relationships with other organizations that we can refer folks to. So I always like to say, don't hesitate to reach out, even if if the question is no, we're not just going to say no, okay, bye. We're going to say no, but let me connect you with someone that can jump in and help out.
Great. Marche, are there age restrictions to apply?
No, we don't have age restrictions to apply. As long as you meet the MusiCares eligibility requirement, you can utilize our benefits. And we do support dependents up to age 26.
And is there assistance for international artists?
That's another really good question. So unfortunately, we do not provide assistance for international artists. You have to be US based with US address and US bill so we can support you and provide those grants.
So we've talked a little bit about how you can apply for a grant more than once. And we have reviewed earlier in the presentation that we don't necessarily have like average grant amounts. It's really a case-by-case situation. But are there lifetime limits? Jen, I'm going to give that to you.
So MusiCares is a 501c3. So we certainly do have parameters and limits within which we have to work, and we do not share those dollar amounts. As we said earlier, each case is considered uniquely. And so a client manager will provide information to a client if they are close to a limit based on prior MusiCares assistance. And we will always provide appropriate resources if we are not able to help.
Great. Stephanie, coming back to healthcare now, if a healthcare professional refers somebody to a different specialist for treatment, can MusiCares help with that treatment?
Yes, we absolutely can. Now, obviously, if a grant has been awarded to cover the cost of that initial provider and those funds have been depleted, we would need to have them apply for some additional funding. Certainly, we try to make it as seamless as possible. So if you had recently completed our grant request process, we could streamline some of that and not need some of the career documentation and financial statements. But we would need to just have that documentation from that new provider showing us what you're facing. But MusiCares always wants to try to ensure we're covering and as much as we can so that you can get as much of the support that you need and deserve.
And so we sometimes get questions from folks around like career development. So a question we get is like, does MusiCares offer any career advancement, music industry mentorship opportunities, industry job placement, or any counseling on the music business? Marche, do we do that?
That's another great question that we get often. And no, we don't. But what I will say is that we often do have webinars that with specialists that discuss these topics. So I always say stay tuned to and check in with some of the webinars that we have going on throughout the year. They may have an expert that is offering support or advice or just education around those things.
And so, we try to do as much as we can for as many professionals in the music industry as we can, but there are some things that we do not cover. So Jen, what are the things that MusiCares cannot cover?
We cannot cover credit cards, taxes, legal fees, property tax, any government-related bills, school loans. Those really are the main ones. Now, what might happen is we could free up, provided it is a situation where we can help and determine it is reasonable, we would provide a grant that might free up funds for you to pay a property tax, but we are not paying those directly.
And now, Stephanie, some folks have ongoing medical needs or chronic conditions, if someone needs ongoing medical care, this is something that we have touched on before, but just to make sure we're being very clear about it, if someone needs ongoing medical care, can MusiCares provide that?
So again, bear with me. It really is a case by case basis. So we cannot help on a long-term ongoing basis. If someone has a chronic condition, we will not be able to continue supporting them for that same need. Can we help short term when when they're like newly diagnosed with this long-term condition, or can we help short term because there's some other variables coming into play, such as waiting for disability or attempting to get onto insurance? Absolutely, we could help on the short term, but we would not be able to be some support for them to continue counting on and coming back to for that same specific need. Our hope would be that when we connected with them, we would be able to support them short term. And before those grant funds were depleted, we would have connected them or helped them create a longer term plan.
For those who might be currently unhoused or do not have permanent shelter, are there any ways that MusiCares can assist with those individuals? I'm going to give that to Marche.
So unfortunately, that is not a service that we offer. What we do recommend is that you guys always reach out to us. Like I'm in Los Angeles, Jen is in New York, and Stephanie is in Nashville, and our services are worldwide, but we have an extensive list of resources in all areas. And so we can't help you with being unhoused, but we can pinpoint you to a place that a resource that you can utilize.
Yeah, exactly. So just like what Marche just explained and Stephanie said earlier, if for some reason what you're asking for is outside the scope of what we can cover, or we just don't have that particular service that you are in need of, we're not just going to be like, sorry, don't got it, bye. We will do our best to connect you to other resources, other relief organizations, and other referrals. Jen, I'm wondering if you can talk a little bit about disaster relief. What is the eligibility requirement for disaster relief? And what is the application process like for disaster relief? And then a third question, what is the average turnaround time to receive support?
So one who is impacted by the disaster. So I'm just going to use the recent hurricanes, Milton and Helene, as examples. So for instance, somebody who's living in Asheville, who lost income, who maybe lost their studio, there was a direct impact because of the disaster. We've helped people who lived outside of Asheville because they had a gig in Asheville. So we're looking at how were you impacted by the disaster. We also have a brief grant request form, and that's because we know that people might not have all of the information that we typically request, and we do want to expedite assistance. In terms of time frame, we try to work as swiftly as we can to get funds out. And really, it depends on the volume of requests that we're receiving. I wish I could give a definite answer, but I will tell you, we are very serious about getting the funds out as swiftly as possible.
Wonderful. Stephanie, I'm wondering if you can talk a little bit about like volunteer opportunities with MusiCares. Sometimes we will get someone who just really wants to contribute their time to like advancing our mission and helping support, the community that they are a part of. Is there anything around volunteering?
Yeah, we definitely get this question a lot, and it's just so humbling that so many people want to be involved with our organization, and so grateful for that interest and desire. There are potentially some opportunities in LA during our big fundraiser every year. But for the most part, we really don't unfortunately have a lot of like hands-on, let's get together and do some volunteer work. It really comes back to what you said earlier, where spreading the word, and not just spreading the word and awareness, because I think that's a part of it. But anyone who's really intimately familiar with us can really help remove some of those barriers. It can feel scary to reach out for help, and calling an 800 number or emailing MusiCares Relief, it's like some abyss that you're reaching out to when you're going through one of your most vulnerable times. And so anyone on this call now has like faces to the names of some of the staff, and can say, I'm familiar, I attended this education, and so I know they can help with that. Or I know there are no income limits. And so don't say that you aren't eligible because you make too much, or that you wouldn't qualify because it's for your daughter. So I think really the best thing that we can, the support we could have when individuals don't have the ability to donate is to just spread the word. And if you know anyone who's going through any challenges who would meet our eligibility of 5 years paid work or credits on 6 commercial reportings, just encourage them to reach out. And the last thing I'll say about that is it's not uncommon that Jen Marche and I will be contacted by a friend or family member and say, they're hesitant to reach out, but I'm wondering, can you help me understand? Or what if I call and with them on the phone? So any kind of soft transfer or something like that, or warm transfer rather, that's always something that's potentially helping too. When you're with a friend who's in need and they're a little hesitant, say, why not? Can I give them a call, or can I send them an email with you right with me?
And so, Stephanie, I'm going to stick with you. And I appreciate everyone kind of going along on this ride with us as we go from this topic to that topic to this topic to that topic. So we're going to keep that going. And Stephanie, I'm going to ask you, so, we talked about the additional services that we offer. So we do have many like virtual, like telehealth opportunities or virtual financial coaching. The biannual clinics, the Vision, our MusiCares, musicians as professionals, music professionals as athletes clinics, and our dental clinics, those happen like in brick and mortar offices, right? Some of them might be sometimes virtual, but mostly it's in the office. Now, do those clinics happen everywhere, or do they only happen in some locations?
One day they'll be everywhere. That's our dream, right? No, great question. So the health team is actively working to expand the locations in which our brick and mortar partnerships exist. Our objective and our goal is to start by accomplishing having one of each of those services. So one vision, one dental, and at least one movement specialist in every major music city across the country. Currently, we have that established in LA. We have it established in New York. We have it established in Nashville. We recently just finalized that in Chicago. Those are the areas where we have all of our services, but we have many cities across the country that have some. In Detroit, we do have a dental partner. We're still working out on the other two. We have some support in Texas and Florida for dental. So if you're ever wondering, we will have that information in the email strand. It's or email communication rather. It very clearly indicates whether it's a virtual telehealth or what city it's in. We welcome referrals. We are somewhat spread out across the country, as Marche said, LA, New York, Nashville, and we've got some staff in other cities, but we aren't everywhere. And so we do welcome if you have a provider that you believe has a good understanding of the industry. We would love to connect with them and make sure that we're a good fit and be able to start offering it in other cities. And yeah, lastly, if you're ever curious or wondering, you can always send us an email as well, and we could let you know where we do have them. And again, we can make sure that you're on our email list so that when and if new ones are obtained, you'll be one of the first to be notified once we have a provider in your area.
Wonderful. Thank you. And we have about 10 minutes left, so we're going to try to get through a few more questions before we wrap up. My apologies for not asking for this earlier, but Chloe, do you just mind bringing us back to the contact us slide? That way, all that information is front and center. And like I said earlier, if the question you have didn't get answered, or if you have a specific situation that you're currently in that you do need help with, or you want to refer someone, please do reach out to us. All of the ways to contact us is on that screen. I'm going to go over to Marche and ask, how do I donate if I want to actually support MusiCares? How do I do that?
Perfect question. You can visit our website, musiccares.org, or you can email in. Sometimes we will get requests from individuals that would like to donate, and they'll email our team. But visiting our website, there's a section there that says donate, and a perfect place to contribute.
Thank you. Jen, we had somebody ask about who they would get in contact with at MusiCares if the situation that they're in can't fit perfectly within an application. You know, they're asking like, is there a social worker or an intake contact person that is available for the messy details that are maybe hard to explain in an application? So maybe really the question here is, who would I speak to at MusiCares if I really just need to talk it out with somebody over the phone?
So my recommendation is that you do in fact complete the request form, because a client manager is going to contact you, and you can then share the information over the phone that you can't provide on the form. If you prefer to speak with a client manager beforehand, just to really find out, hey, is this an appropriate resource for me? You can certainly call our 800 number. You can email the MusiCares Relief at musicares.org, and just ask for a call. But my recommendation is you do speak with somebody before assuming this is too messy.
Mm-hmm.
Yeah, I'm really glad that person asked that question, because we do get that a lot. And it's a lot of pressure when you're filling it out. You want to make sure you fill it out perfectly, or that you have enough information. And so I'm really grateful they asked that, because we just want to clarify and make sure they realize that written documentation is definitely not the only content or information that will be utilized when we are reviewing it. That's just the first step. And then you will absolutely be contacted to make sure, fill in any gaps, get any additional information, and answer any additional questions. So, yeah.
And I just want to add, I think that's also a great example of how we look at cases holistically, right? So there might be multiple things that are going on, and we can then point you in the direction of how MusiCares can assist in various areas. Just like Stephanie said before, you might be coming due to a medical issue, but perhaps there's a mental health need as well. So easier to talk that out with a client manager.
Absolutely. So in the couple of minutes that we have left, we did go over lots of questions, lots of information. Like we mentioned a few times earlier, we will send out a recap of all the information that we've shared. Again, you can contact us, but we will be sending out a recap after the webinar. So just give us a little bit of time on that. And I'm wondering if we can close out by actually going to each one of the managing directors and just any final closing words, anything that you want to really like hammer home for people, anything that we didn't cover that you'd like to just kind of include a little note on at the end, just any final words, and we can use that to wrap up. So I'm first going to go to Stephanie for any final words, anything that you just want to leave us with.
Yeah, I mean, just gratitude for being here today, for learning what resources are available to you and your community, and just trying to reiterate what we've already said, which is that you deserve this support. None of us want to go through difficult times. None of us want to have to ask for help, but MusiCares is an organization that is here because you not only need the support at times, but deserve it. So if you're ever scared or hesitant to reach out, we just want you to feel safe to do so. At least just shoot us a little email, give us a chance to make you feel comfortable before you decide that asking or seeking support isn't for you.
And Marche, what do you have for us?
Absolutely. Sorry, absolutely. I mean, thank you guys for being here. We're just super passionate about helping. And like Stephanie said, you beyond deserve it. I know some things that you have to ask for help for are scary. I know, like, essentially like mental health, like going to therapy and maybe going and starting a recovery journey is a very, very scary thing to do. But we have a very trained staff that has so much passion and empathy for helping others that we just want to help you in the best way possible, provide resources. So please don't hesitate to reach out. There are no dumb questions. We want to help. And even if we aren't able to help you, we want to connect you with someone else in another organization that can.
And Jennifer, can you close us out?
First, I'm going to thank everybody for those very kind words that I keep on seeing popping up. What comes to mind for me is people who are not performers or the artist. We've had people say, I'm not in the music industry yet. They're the stagehand, or they're the producer, or they're the engineer, because all of those concerts and albums can't happen without these people. So if you want to ensure that you are in fact eligible, please call us without assuming that you are not.
Well, thank you so much to Halen, Chloe, Nana, Stephanie, Jennifer, Marche for just spending some time to go over all of this information, all of our programs and services. And thank you all folks for joining us, for spending an hour of your day with us. Like we all said, please do reach out to us. The ways to contact us are up on that screen, and you will hear from us after today's webinar ends. So thank you so much again for joining, and take care. Bye-bye.
Thank you, everybody.